Well, the holidays are sure fun and festive time of year. No one, though, of course, wants to get sick or injured in that time. Of course, it happens. So what do you do when it does happen? Dr. Philip Lamptey from Cone Health Virtual and Urgent Care is joining us today. And so we're going to go over some things that you should know for a healthy, hopefully injury-free holiday. All right, to start off with, let's just review some kind of common holiday injuries and like how to prevent them. Let's talk about what happens like putting up decorations and things like that, falling injuries.
Yes, decorations present a fall risk if you don't do it right. First of all, you have to think about the Christmas tree itself. If you're putting it up, it should be on a level ground, and you should have different things that you need to put ornament on it. So if the Christmas tree is tilted over or the base is not well supported, it could fall over, causing injury to people. If you're putting up the Christmas tree with ornaments, you need a good ladder on a level ground to do that. Christmas tree decorations come with cords, so you should make sure that the cords are safely tucked away and the high traffic areas at home is also free from these cords. So those are some of the basics that you can think about when you're putting up Christmas trees.
Of course, everybody thinks, okay, we do this every year, once a year, we've got this down pat. And yet every single year, more people end up in the emergency room or at urgent care. When do we know that we need to go to the emergency department versus urgent care?
Well, so accidents happen. So if should somebody get injured, you could think about it as if you have minor cuts or abrasions, or even with the cuts that you can control the bleeding. Those are ones that can go to urgent care. If you have injuries with no significant deformities or deep wounds, that also is one that you can go to urgent care. Or somebody hits your head, but they didn't lose consciousness, or they are not acting confused, or they are not having difficulty with their vision. Those are people that we can see in the urgent care as well to determine if they need further care or not. And if you have wounds that are not deep, you could certainly come to the urgent care to be evaluated.
Okay, gotcha. All right. So another kind of injury that maybe we don't think about during the holidays, and that is choking. That is a major concern. We're eating all these different fun things. We're kind of talking and laughing and eating all at the same time. So what are some steps that we need to be aware of?
So choking is a big issue for children under 5 years old. It's the fourth leading cause of death for children under 5. For the Christmas holidays purposes, we should think about not just the ornaments, the small ornaments that children can put in their mouth and choke on, but also food. Food is the number one causes about half of the choking incident, so we should be mindful of that. Hard candy, popcorn, you could think of even peanut butter can cause choking, so we should be mindful of that. For the sake of the holidays, just make sure that you don't leave small ornaments on the floor for kids to pick up, or keep your ornaments a little bit high on the tree for kids under 5 not to get hold of and put in their mouth.
Okay.
And also, you could think about the batteries and the balloons. They also present a choking hazard for kids as well.
Yeah, and batteries are in so many toys and things of that nature, and light ups, decorations, and that kind of stuff. We do need to be careful with those, especially when we're changing them out. We put something on the table to take a new one, and then there it is. Okay. Respiratory illnesses. This is the time of year. I know I've been battling it myself. So what are the do's and don'ts to help us kind of prevent getting sick, or as we're sick, what we should be doing to keep ourselves as healthy as possible?
I think the time of the year is here again. I'll recommend everybody get their vaccinations updated, COVID vaccines and flu vaccines. And recently, RSV has also become one of the big topics that we could talk about. If you have a child who is less than 18 months of age, or you're an adult over 60 years of age, or you're pregnant and you're in your third trimester, please discuss vaccination against RSV with your doctor. For pregnant women, that will provide some immunity to the children as they are born into the RSV season. The other things you can do is to make sure that you have a mask on hand, so that if you're in a crowded place, you could always put on your mask. It offers some protection. And just make sure you're washing your hands frequently if you have soap and water around. Otherwise, hand sanitizer is a good option if you don't have soap and water.
Of course, right before we head to break, we want to get this in. If you're sick or injured during the holidays, a lot of times we think the only options are emergency room, urgent care, getting in to see my doctor, but we also have virtual care.
Yes, so it's not fun if you are with family and you don't feel good and you have to go to the ED and wait for long hours. Uh, we have more options now. One of them being the use of virtual or technology to help us access care from home, from the comfort of our home, using our phones, computers, iPads, and things like that. For Cone Health, you could access care through the website. We have one that you can leave an online, you can fill out an online questionnaire. Then we will get you a certified physician assistant or a physician will read it and give you your diagnosis and recommendations or in a treatment plan. The other way is also to schedule another visit type, which is a virtual urgent care where you can have a secure video chat with a provider to talk about what is going on with you and how you can get treatment for that. The good thing about virtual care as well is that if you live anywhere in the state of North Carolina, you can get through to it through our platform to get virtual care. And even if you're in Virginia, you could still access virtual care. So it's very convenient and allows us to get care that we need at home. And it does not require you to be very savvy with technology. It's pretty much very instructive, and you could get through it doing it yourself if you're not very tech savvy.
Not feeling so well. So, what are our options if you're out of town?
If you're out of town for mild illnesses and you're in the state of Virginia or you're out of town but still within North Carolina, you could reach out to us via our virtual platform and leave a message or leave a detailed description of what's going on. One of our providers will reach out to you. You could also do a secure visit, which is a video visit with a provider who would listen and talk to you, ask questions to come up with a plan to kind of deal with your illness and can call in prescription medications to areas that you are in if indicated.
Okay. And if you're outside of North Carolina, outside of Virginia?
Then I would say that just reach out to an urgent care near you,
Okay.
or if it is an emergency, go to an emergency room near you, wherever you may find yourself.
All right. And as we're traveling around, I mean, we don't plan on getting sick, but it happens. What kinds of things do you think we need to be packing or taking with us to have on hand just in case?
I think when you're traveling around in this cold environment, you should always, especially if you're going by road, you should always have a few things that would keep you warm if you run into issues with your car on the way. Blankets, a lot of water, having jumper cables, reflectors, and having a first aid kit in case there is an incident that you need to take care of, bodily injuries, and things like that. You should also have warm clothing and gloves. Mittens are also a good thing to have on hand. And those are some of the basic things that you can have when you're traveling around. If you're traveling by air and you're going to be on the airplane with a lot of people, a face mask is definitely one that would protect you from the respiratory illnesses we've talked about. And you could also, a hand sanitizer would also be very handy walking through the airport with very high touch areas. That would protect you from getting some of these viruses into your system.
All right, we have just a little over a minute or so, and I know we touched on this briefly, but for someone who hasn't used virtual care before, maybe they think they're not able to be able to figure it out. What advice do you have?
I would say that it's very easy to get a virtual encounter with a provider. Once you get to the website, it walks you through the process, and then you could just do that at the end of the process. Just if you leave an e-visit, we get back to you. If you're doing a secure visit, it becomes a very seamless process where you log into the virtual space, the provider logs in, You guys get done with the visit, and that takes care of itself. You don't need to be tech savvy to be able to do a virtual care. We have a lot of elderly people who've been able to do it, and the younger people, they are tech savvy anyway, so they find it very easy, and they can sometimes help the parents navigate that if that's an issue.
Yep. Don't think twice about asking for just a little bit of help to make sure you get to be seen by the doctor. Dr. Lamptey, thank you so
Absolutely.
much for your time and expertise.